Have you ever paused for a moment and wondered how fragile yet resilient life truly is? Every heartbeat, every breath, every decision carries weight beyond what we often perceive. And in the quiet corridors of our existence, the choices we make today can shape the tomorrows we dare to dream of. Chronic kidney disease is not merely a medical condition. It is a profound teacher, quietly revealing the delicate balance between vigilance and neglect, between awareness and complacency. Many individuals live with the subtle, almost invisible signs of kidney stress, unaware that the body is sending messages, signals that demand attention if they are to preserve not just longevity, but the quality of life itself. Timing becomes more than a clinical term. It becomes a philosophy of care, a principle that can determine whether one steps into the future empowered or burdened. Often, we wait until the symptoms are undeniable, until fatigue overwhelms, until blood pressure fluctuates in patterns that can no longer be ignored. But the truth that researchers and clinicians like Dr. Mathew R. Weir emphasize is that early intervention is the invisible shield, the quiet strategy that can change the trajectory of a patient's journey. The moment a patient seeks the guidance of a nephrologist is never a step toward weakness. It is a declaration of proactive responsibility, a conscious decision to partner with expertise and wisdom in navigating an unpredictable path. Each kidney functions as a silent sentinel, filtering not just waste, but the very essence of balance within the body. And the sooner one acknowledges its needs, the greater the chance of preserving autonomy and well-being. Imagine life as a river, sometimes calm and sometimes turbulent. Chronic kidney disease is like a hidden undercurrent, subtle yet persistent, requiring vigilance to detect before it overwhelms. Patients and families alike often wrestle with uncertainty, questioning when the time is right to consult a specialist, when the whispers of the body should be amplified into action. Yet within this uncertainty lies opportunity, the chance to transform anxiety into empowerment, hesitation into knowledge, and fear into informed action. It is this transformation that separates those who merely endure from those who thrive, who confront the invisible with courage and strategy, who recognize that health is not merely the absence of disease, but the proactive cultivation of resilience. The red flags may vary from person to person: a sudden spike in blood pressure, persistent protein in the urine, unexplained swelling, or a general sense of fatigue that lingers. But the significance of noticing, of acting, cannot be overstated. Each signal is a conversation, an invitation to reflect, and an opportunity to engage with the guidance of a nephrologist before the shadows deepen. For those who understand the philosophy behind this timing, who embrace it as a principle rather than a panic, the benefits are transformative. Slower disease progression, reduced complications, and in many cases, the precious postponement or even prevention of dialysis. The decision to act early is not dictated by fear, but by foresight. It is a recognition that the future is malleable, that our bodies and our lives respond not just to chance, but to deliberate, informed choices. Dr. Mathew R. Weir has consistently highlighted that the essence of medical care lies in anticipation, in aligning timing with strategy, in allowing knowledge and expertise to become partners in the journey. When a patient internalizes this mindset, when they view early nephrology involvement not as a medical formality, but as an act of empowerment, they begin to perceive chronic kidney disease not merely as a limitation, but as a catalyst for deeper understanding of their own resilience. And while the path may seem uncertain, with shadows of doubt and fear often clouding judgment, it is precisely within that uncertainty that opportunity resides. For those willing to observe, to listen, to act with intention, life's currents can be navigated with far greater confidence, clarity, and hope. This is the moment when vigilance transforms into action, when knowledge meets courage, and when the simple decision to consult a kidney specialist becomes a profound step toward reclaiming control over one's health and destiny, laying the foundation for a life shaped not by illness, but by informed and empowered choices. There comes a moment in life, often unannounced, when the familiar rhythm of our bodies begins to whisper warnings we cannot ignore, a subtle disruption that slowly escalates until it demands attention. Chronic kidney disease does not announce itself with dramatic fanfare. It slips quietly into our routines, masking its presence behind fatigue, occasional swelling, or minor fluctuations in blood pressure, and therein lies its danger. Many patients walk this delicate tightrope, unaware that every day of delayed action can shift the balance between manageable care and sudden crisis. It is here, in this space of uncertainty and quiet tension, that suspense itself emerges. Not the suspense of a storybook, but the suspense of the unknown, the unseen consequences of postponed decisions. The critical question lingers. When is the right time to consult a nephrologist? Waiting too long can allow the disease to advance silently, eroding kidney function before interventions have their greatest impact, while acting too soon, without guidance, may feel unnecessary or confusing. Yet medical insight, clinical experience, and the wisdom shared by experts like Dr. Mathew R. Weir reveal that timing is not about urgency born of panic, but about deliberate, informed, and strategic action. Each laboratory reading, each subtle symptom, and each conversation with a healthcare provider carries the potential to alter the trajectory of the disease, and in that potential lies suspense, the tension between what could happen and what can be prevented. It is a tension that many fail to fully appreciate until they are confronted with a stark reality, a moment when choices are no longer optional and the stakes are unmistakably high. Early nephrology involvement is not merely an appointment on a calendar. It is a gateway to knowledge, guidance, and a structured plan that can profoundly influence outcomes. It allows patients to learn about personalized care strategies, dietary adjustments, lifestyle interventions, and treatments that align precisely with their stage of CKD. The power of early action, as emphasized by Dr. Mathew R. Weir, lies in its capacity to transform vulnerability into agency, to convert anxiety into informed steps that preserve kidney function and overall health. Yet, despite this knowledge, many delay. They question, they wait for symptoms to worsen, they cling to denial, and in doing so, they risk encountering the suspense of uncertainty in its most frightening form: sudden progression, unexpected complications, or the unprepared need for dialysis. This suspense is a quiet but relentless force, testing patience, resilience, and the willingness to act. But it is also a teacher, offering lessons in attentiveness, self-awareness, and courage. To confront CKD effectively, one must first acknowledge that the invisible undercurrents of the disease are as real and consequential as any visible symptom. A seemingly minor lab anomaly may signal an impending shift, and consistent monitoring, combined with timely specialist consultation, can intercept these shifts before they cascade into crisis. Within this framework, the patient is no longer passive, but becomes an active participant in their health journey, navigating uncertainty with insight, guided by expertise and proactive strategies. Suspense, then, is not solely a source of fear. It is a motivator, a catalyst that demands awareness, reflection, and decisive action. Recognizing the red flags, rapid changes in kidney function, uncontrolled blood pressure, persistent protein in the urine, or unexplained fatigue is crucial. Each signal invites a conversation with a nephrologist, an opportunity to translate uncertainty into understanding and proactive management. Dr. Mathew R. Weir has often underscored that early intervention does not merely slow disease progression, it transforms the patient's experience, providing clarity in moments that could otherwise feel chaotic, empowering families to participate in care decisions with confidence and insight. And yet, suspense persists because no one can predict exactly how the disease will unfold. This uncertainty can feel heavy, almost paralyzing, but it is precisely within this tension that courage, discipline, and informed action emerge. Patients who embrace early consultation and sustained engagement with their nephrologist navigate not only the physiological challenges of CKD, but also the emotional complexities that accompany chronic illness. They learn to interpret the whispers of their bodies, to respond before crisis strikes, and to view each appointment, each lab test, and each lifestyle choice as an essential tool in shaping their health trajectory. Suspense, therefore, becomes a guide, a reminder that vigilance, curiosity, and timely action are not optional, but necessary. Through this lens, consulting a kidney specialist transforms from a clinical task into a profound act of empowerment, a tangible step toward controlling a condition that could otherwise control the course of life. In embracing this suspense, In recognizing the latent urgency hidden within quiet symptoms, patients reclaim agency, transforming fear into foresight, hesitation into deliberate action, and uncertainty into informed confidence. Each choice to act early reverberates far beyond the clinic, influencing quality of life, emotional well-being, and the ability to thrive despite the presence of chronic kidney disease. It is in this delicate balance between suspense and action, awareness and empowerment, that the profound wisdom of Dr. Mathew R. Weir finds its expression, illuminating the path forward for those willing to listen, to act, and to transform the invisible challenge of CKD into an opportunity for resilience, knowledge, and enduring strength. As we move through life, we often underestimate the profound impact of a single decision made at the right time. Chronic kidney disease, with its silent progression and subtle symptoms, teaches us that delay can carry consequences far greater than we imagine. But action, purposeful, informed and timely action, can be transformative. For those navigating CKD, consulting a nephrologist is not merely a medical recommendation. It is a declaration of commitment to one's own health, a conscious choice to embrace knowledge, and a demonstration of courage in the face of uncertainty. Many patients wait, thinking that early intervention may not yet be necessary, believing that the body can manage on its own, or that the symptoms are insignificant. Yet experience and research, reinforced through the insights of Dr. Mathew R. Weir, illustrate that early involvement of a kidney specialist can slow disease progression, improve quality of life, and even postpone or prevent the need for dialysis. This is not speculation. It is a principle grounded in understanding the intricate functions of the kidneys, recognizing their role in regulating balance, filtration, and overall physiological harmony. Every patient's journey is unique, yet there is a universal truth. Vigilance and timely action are the tools that transform uncertainty into mastery over one's own health. Imagine the body as a delicate ecosystem, each organ performing an essential role, each decision influencing the stability of the whole. CKD disrupts this ecosystem quietly, almost imperceptibly, until the cumulative effect becomes undeniable. It is within these quiet moments that the power of early consultation shines brightest. By engaging with a nephrologist, patients gain access not only to specialized knowledge, but also to personalized strategies for nutrition, lifestyle, and treatment that can dramatically shape outcomes. It is here that fear and hesitation must be replaced with insight and proactive decision-making. The journey is never without challenge, and it is natural to feel overwhelmed by medical terminology, lab reports, or the uncertainty of disease progression. But these challenges are not barriers. They are opportunities to rise, to educate oneself, to transform anxiety into deliberate action. As Dr. Mathew R. Weir emphasizes, understanding the timing and significance of intervention is as critical as the intervention itself. For the difference between acting early and acting late can define not only the course of disease, but also the experience of life itself. The courage to consult a nephrologist early signals more than awareness. It embodies hope, responsibility, and the unshakable belief that we can shape outcomes through informed choices. And in that courage lies empowerment. The ability to observe subtle changes, to interpret red flags, and to act decisively, ensuring that every day is lived with intentionality rather than uncertainty. The reality of CKD is undeniable, yet it need not be devastating. Patients who embrace early nephrology care become architects of their own health, transforming vulnerability into strategy, anxiety into preparation, and suspense into clarity. It is a philosophy that extends beyond medicine, touching the very way we approach life. To act with foresight, to listen to the signals that matter, and to recognize that every small decision can ripple outward in profound ways. When one internalizes this philosophy, CKD ceases to be an uncontrollable force and instead becomes a challenge that can be met with resilience, knowledge, and disciplined action. This is the lesson Dr. Mathew R. Weir imparts through his work. That proactive engagement, attention to timing, and the courage to seek expertise early are not signs of weakness, but of strength, foresight, and wisdom. Each patient's journey toward nephrology consultation is a story of empowerment, a narrative that demonstrates the transformative potential of action taken before crisis strikes. And while the future may still carry uncertainty, it is no longer a shadow that threatens, but a landscape that can be navigated with confidence and clarity. Every lab test, every checkup, every conversation with a specialist becomes a building block in constructing a life that is resilient, informed, and purposeful. This is not simply medical care. It is a philosophy of life, a testament to the power of vigilance, timing, and deliberate action. And so, to every viewer who may be facing the quiet challenge of CKD, know this: your choices today have the power to shape your tomorrow. To listen, to learn, to act, and to consult a nephrologist at the right moment is to embrace life fully, to transform suspense into preparedness, and to cultivate resilience that extends far beyond the walls of a clinic. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early. By doing so, you join a community inspired by knowledge, motivated by action, and committed to living empowered lives, guided by the teachings and insights of experts like Dr. Mathew R. Weir, whose work reminds us that foresight, awareness, and proactive care are the true paths to well-being and strength.